Here, some question and answer regarding dysarrhythmia. The number one, which of the following cardiac arrhythmias would not be amenable to treatment with digoxin? Answer is premature ventricular contraction. What is premature ventricular contraction? It is extra heartbeat that begin in one of the patient heart to lower pumping chamber. This the extra beat disrupt your regular heart rhythm. Sometimes it causes you to feel a fluttering or script the beat in your chest. Premature ventricular contraction. Despite question number 2, despite the good blood pressure control, the healthcare provider might change the patient drugs from AC inhibitor to an ARB, angiotensin to receptor blocker, because AC inhibitor can cause dry cough. ARB does not produce a dry cough, right? What is occur in case of AC inhibitor? AC inhibitor are useful in a variety of disorders. Which of the following statements are true about both its usefulness in the disorder and reason for its use? They said number C, both A and B are true and reason are correct. What they said? AC inhibitor is useful is variety of disorder. Why? Because stable angina, because it decreases the thickening of ventricular wall. How they decrease? Because they decrease the demand of oxygen to the tissue. And heart failure, because it reduces the remodeling of injured myocardial tissue. So both is helpful for the patient. Jacob has hypertension for which a calcium channel blocker has been prescribed. This drug helps control the blood pressure by how? Calcium channel blocker mechanism of action. They decrease the amount of calcium inside the cell. Which of the following adverse effect may occur due to calcium channel blocker? What are the side effects? Patient develop edema in extremity of the hand or foot. The calcium channel blocker called amlodipine. What we could teach our patient if they took amlodipine, tell your patient to avoid grapes fruit juice as it affects the metabolism of these drugs. Larry has heart failure, which is being treated with digoxin because it exhibits negative inotropic and positive chronotropic effect, but they said none of A or B. So digoxin do not show negative inotropic or positive chronotropic effect. What is inotropic or what is chronotropism or effect? situation of any stimulation of beta 1 adrenergic receptor in the heart, result of the positive ionotropic effect. It means increase the contractility of the heart, and chronotropic effect means if it is positive, increase the heart rate. Another word is called dromotropic, increase the rate of conduction through AV node, right? So ionotropic is a contractibility, chronotropic is a heart rate, and dromotropic is a rate of conduction through the AV node. Serum digoxin level are monitored for potential toxicity. So monitoring should occur because of a reference point is needed in adjusting a dose. So digoxin is a narrow therapeutic index we need to check to prevent the digoxin toxicity. Which of the following is true about procainamide? Procainamide is a arrhythmic medication we use for dysarrhythmia. What is true about it? Dose of this drug should be taken evenly spaced among the clock to keep an even blood level. Amiodarone has been prescribed in a patient with supraventricular dysarrhythmia. The patient teaching should include all except take a hot shower or bath if you feel dizzy when you take amiodarone for supraventricular dysarrhythmia. NP order a thyroid panel for a patient on amiodarone. The patient tell NP that he does not have thyroid disease and want to know why the test is ordered. Which of the correct response? Amiodarone inhibits the enzyme that is important in making the thyroid hormone and can cause hypothyroidism. So we need to check it. Isosorbate dinitrate is prescribed for a patient with a chronic stable angina. This drug is administered twice a day, but schedule 7 a.m. and 2 p.m. because nitrate tolerance can be developed. Art is 55 years old, smoker, who has been diagnosed with angina and treated by nitrate. He complained of headache after using this nitrate. An appropriate reply might be, headache are common side effect with these drugs. How severe are they? In teaching about the use of sublingual nitroglycerin, the patient should be instructed to place one tablet under the sublingual or tongue if the chest pain occur and allow it to dissolve. Donald has been diagnosed with hyperlipidemia. Based on his lipid profile, atorvastatin is prescribed. Rhabdomyolysis is a very uncommon but serious adverse response to this drug. donor should be told if seen any kind of sign and symptom of the rhabdomyolysis. Example, rhabdomyolysis means muscle breakdown, and this muscle breakdown tissue passing through the kidney and kidney shutdown. Report the muscle weakness and tenderness and dark urine of his provider immediately. It indicates develop the rhabdomyolysis because of atorvastatin.